Hi, good evening. We are just waiting to see if someone else wants to join our webinar. Thank you for joining. I will be with you guys in 1 minute. Well, it's 7 p.m. in Auckland, New Zealand. It's 10 p.m. in Tijuana, Mexico. You are very welcome to join our webinar. Thank you very much for joining. My name is Luis Mendoza, and I am the Patient Relations Manager of Do It Bariatrics by Luisiana Valenzuela. We are very proud for you guys to be here. We're very happy. And if you have any kind of questions or if you need any additional information, there is a button to raise your hand, and I will be looking at it, and we'll be starting in 1 minute. Okay, we are here in time. Welcome, Tanya. Welcome, Nikki. It's very glad to have you guys here. Thank you very much again for joining us. Like I was saying, my name is Luis Mendoza. I am the Patient Relations Manager for Do It Bariatrics. Do It Bariatrics, it's kind of new company. We have been in business for almost a year now. We are led by bariatric surgeon, Dr. Luisiana Valenzuela, but she has more than 15 years in experience and more than 10,000 successful bariatric surgeries. But she recently switched through this new company, Do It Bariatrics, that we are hosting this webinar today. Thank you again. Thank you for joining. We are going to get started now. Okay. Well, on this webinar, we're going to cover the topic of Do It with Confidence, your guide to weight loss surgery in Tijuana. Tijuana has become one of the top destinations for bariatric surgery in the recent years. I'm assuming that you probably are in the process of choosing which surgeon or learning how to get to bariatric surgery in Tijuana, and that is the main reason that we are here. So we will be discussing everything that you need to know about weight loss surgery options and why Tijuana is the world capital of bariatric surgery in the world. And we will also be having a Q&A session at the end. So if you have any kind of questions, you can just press the button that says Q&A. Just type in there your question, and I will be more than happy to answer it. Okay, so just introducing, first of all, our lead bariatric surgeon. Dr. Luisiana Valenzuela, as I'm sure that you're aware already, she's one of the most experienced bariatric surgeons in Tijuana. She has performed over 10,000 successful bariatric surgery throughout her career. She has more than 15 years of experience, and she is one of the very few bariatric surgeons in the world that is double board certified as bariatric surgeon, as general surgeon, and she is an active member of all the major and main international organisms that oversee bariatric surgery all over the world. She was also head of one of the top medical tourism providers in Tijuana, but she has recently started her own company, which is Do It Bariatrics. That's one of the reasons that we are here. And also one of the good things about Dr. Luisiana Valenzuela, and one of the things that makes her an expert in bariatric surgery, is that she's a pioneer in the 3-incision gastric sleeve. Usually or typically you will find on old literature on the internet that having a gastric sleeve, you will need to have 5 incisions. But Dr. Valenzuela, it's one of the first surgeons in the world that started using only 3 incisions. Okay, so just to get started and just to have an overview, What is obesity? It's one of the main reasons that obviously we are here. Obesity, we can understand obesity as a chronic and complex disease that is characterized by the excessive amount of body fat. This is usually what has happened. It's on medical literature and science. It's considered that obesity it's the main disease for the 20th and the 21st century. Um, Back in the day, humans before, when we started evolving, we were hunter-gatherers, that we were all over the place trying to gather or having food, and our bodies are designed to have very heavy physical activity because it was very hard to get food. So what our body started doing, it's storing fat for when we are not having food available. But now, capitalism and everything that it's going on, getting food, you don't have to spend as much energy as before. I mean, you need to spend money, but not energy. So our body, it's still adapting to it. So that's one of the reasons why when we have unhealthy habits or when we don't have a strict calendar to get our food, the nature of our body has us to store fat. This is the main reason why we in this century have so many problems with obesity. In obesity, it's this is very important because there is a very common misconception about bariatric surgery. Bariatric surgery, it's not a lot. It's not a cosmetic procedure. It's a procedure that tries or is the most effective treatment for a chronic and complex disease that is obesity. The way that we measure or that the medical community measures or the most common way that the obesity is measured currently, it's by body mass index. Typically, the body mass index, it's a ratio of your height and your weight. So it's like an average. So typically considering above 30 of BMI is that when you are considered obese. This is a chart that you can see online, or that you can see on your screen on body mass index. I will go to the next. Okay, but obesity, it's not a problem by itself. Obesity, the problem with obesity, it's the problems or the side effects that you will get after obesity. On the screen, you're going to see one of the main effects of the obesity on your health, which are increased depression, the risk of having a stroke, sleep apnea, the increased risk of a heart attack, liver disease, gallbladder issues, reflux, kidney failure, weakened muscles and bones, infertility, skin rashes, and there are a lot of cancers that are associated with obesity. So being obese, it's not something just on your looks. It's something that takes a toll on your health. And that's why it's very important to attack. And that's why we are promoting bariatric surgery as one of the main treatments currently to cure obesity. And speaking of the treatments, there are typically considered, or we can group treatments for obesity in 4 groups. The first one that is less effective, it's diet and exercise. Diet and exercise is not designed for everybody. It's for only certain specific people who have certain ability to really lose weight through diet and exercise. But when you haven't or when you're not available to accomplish your weight loss goals with diet and exercise, most of the people consider or go to nutrition counseling or weight management programs. That it's also not one of the most effective treatments for obesity. And in the recent years, there has been a lot of pharmacotherapy or a lot of medications that have been promoting themselves as the treatment for obesity. Unfortunately, with medications, it's very hard to achieve the desired results. And it's not a permanent solution, and it's also not as effective. So it's currently considered by the scientific and medical community that the main treatment for obesity is bariatric or metabolic surgery. Uh, there are several studies that prove that it's the most effective for significant and sustained weight loss, and usually and often improves or even solves obesity-related conditions like hypertension, type 2 diabetes, and it's also a life extension because it will really help you with your overall health. We will help you with your quality of life. And what helps is not the surgery itself, it's losing weight. That we will get to that in a moment. So bariatric surgery or weight loss surgery. What is the bariatric surgery? And bariatric surgery, we refer, it's when a doctor performs a surgical procedure to diminish or with the goal to have weight loss. There are different approaches of how these procedures are done. But typically, bariatric surgery it's grouped in two effects. It's the first, there are certain procedures that are considered a restrictive procedure, which means that they will restrict the size typically of your stomach, so we can restrict the amount of food that you can intake. And there are other procedures that are called malabsorptive. This is when the surgeon changes your anatomy to diminish how your body absorbs its nutrients. And both approaches, the main goal or the main objective is for you to lose weight. Well, I was covering these types of bariatric surgery. So typically, I'm assuming that you already know about these different approaches. But the most common bariatric surgery currently is the gastric sleeve. And the gastric sleeve, what it is the surgeon will cut a part of your stomach, making a tube-shaped stomach that is going to be smaller than the regular stomach. There are also the broken Y gastric bypass that it's one of the most effective surgeries. In this type of surgery, the surgeon will change the anatomy of your stomach. So having the food bypassing your, obviously the stomach, significant and or resulting in significant weight loss. Okay, so there are certain things that you will need to know and that are very important to understand about bariatric surgery. The first and the main one that I think it's one of the most important to consider. It's that bariatric surgery, it's not the solution itself. Bariatric surgery is a tool that you will get on your body so you can accomplish weight loss with your effort and with your discipline. But the bariatric surgery by itself is not going, it's not like you're going to exit the OR with all your weight or your excess weight lost. You will need to start working. So it's very important to understand that it's not the easy way out. On bariatric surgery, it's just like a tool. It's like having a hammer or a hammer to build a house. You're not going to be able to accomplish your goal if you don't do your job. So you need to really have or really look for a group of bariatric surgery that are going to be able to provide you with all the information that you need to really learn how to use this tool that is the bariatric surgery. Obviously, the bariatric surgery, each kind of bariatric surgery has different advantages and disadvantages, and different risk and different recovery times. So we will cover or we will try to explain the different types of bariatric surgery that is going to help you at the end so you can choose what type of bariatric surgery is going to be the best one for you according to your needs, according to your goals, and according to what you need to do. So determining if you're a candidate for bariatric surgery, the first or the most important, the most important reason to determine if you are going to be a candidate for bariatric surgery, it's obviously being obese. Okay, you also need to understand what to expect, what type of bariatric surgery that you need, the different advantages and disadvantages, like I was saying before, of the different surgeries, the different risks, and the different recovery times between each type of surgery. Okay. So to be a candidate for bariatric surgery, you need to have a BMI that is going to be higher than 30 with a comorbidity, which means one of the side effects that we were talking about before, if you are suffering from one of the conditions related to your obesity and your BMI is between 30 and 35, that will make you a candidate for bariatric surgery. Or if your BMI is higher than 35, then you're going to be a good candidate for bariatric surgery. Obviously, every case it's reviewed and the doctor will determine if you're a candidate because we need to review each and every case. And that is the importance of the health questionnaire that we send to every patient. Every health questionnaire that we received, it's reviewed by Dr. Luciana Valenzuela itself, and she is the one that determines if you're a candidate, if you're not a candidate, or if she needs any additional information before determining if you're a candidate for bariatric surgery. The questions that have the questionnaire and the whole process, it's a process that has been designed specifically for medical tourism. So in the health questionnaire, we have the key questions that you need to answer for the information that the doctor needs before determining if you're a candidate for bariatric surgery. And you can rest assured that the doctors will thoroughly review your information. And a lot of the times, or it's very common, that the doctors request us as coordinators to request more information from you. And this is the place where your coordinator really helps you. And it is our job, obviously, to be with you, compelling and getting and compiling all the information that the doctors will need to determine if you're a candidate for bariatric surgery, obviously, but also what to expect, what will be the risk, and what will be the best option for either a specific patient. Okay, so what to expect after bariatric surgery? Expecting after bariatric surgery, you will have to, obviously, the main goal is to lose weight. But the same way that obesity has some side effects, there's exactly the same way that losing weight has some desired effects. The desired effects that you will receive after having your bariatric surgery, it's obviously you're going to be a more happier person. Your mental health is going to improve a lot. The way that you sleep also improve. Your daily living, your regular task, uh, pain management, all of this really improves. So it sounds like a cliche, but what you will get after a bariatric surgery, not after bariatric surgery, after losing weight, it's an increase of your quality of life. And this is like the most important thing, and that has to be the main goal when considering bariatric surgery. And we are going to start directly on why most of the patients come to Tijuana to have bariatric surgery. Obviously, the main reason is to save money. On the screen, you're going to see a chart, or you are seeing a chart right now on the average cost of each of the bariatric surgeries in Mexico, if we are comparing with the cost or the average cost in New Zealand. As you can see in the chart, you can save 60 to 70% what you will pay on New Zealand. You will save, like I was saying, 60 and 70% if you have your bariatric surgery in Mexico. And the most important thing, without compromising quality. We have had a lot of patients from New Zealand that one of the main things that we get after having the bariatric surgery, or one of the main comments, it's the quality of the facilities that are very like any first world country. The other thing that it's, or the second reason why patients seek bariatric surgery in Tijuana, it's because of the waiting times. When you want to have your bariatric surgery, usually in some places like New Zealand, some insurance cover the procedure. The problem is that you will have to go over a lot of hurdles before getting the actual procedure. Instead of coming to Mexico, which we have a medical tourism protocol in place, that you can get approved and you can have your surgery in less than 2 weeks. And the most important thing, without compromising quality, without compromising bedside manner, and also the expertise of the doctors. It is considered, or on average, in some during some seasons or some very high seasons, it is estimated that in Tijuana are performs more than 100 bariatric surgeries per day. So this is a lot of advantages because Tijuana has become one of the most important hubs for bariatric surgery in the whole world. So the quality or the expertise of the doctors, obviously, it's one of the main reasons, but also the quality of the infrastructure in the facilities in Tijuana, it's also very high end because there are a lot of big hospitals investing their money in Tijuana because um, the owners know that it's a very good business to have bariatric surgery in Tijuana because of the amount of patients. So what we are having with this, it's like a virtual circle. Um, Better hospitals, better doctors, and more patients. And this results in the quality that we can offer as a city, as a community, as one of the top, or probably the top medical tourism destination in the whole world. Okay, so there are certain things or some checklist of the things that you will need to do, or the process before um, getting bariatric surgery into one. When choosing a bariatric surgery or a medical tourism facilitator to help you to get bariatric surgery in Tijuana, there are things that you need to really take the importance. Uh, an honest doctor, an honest company will make sure that you have all the information that you need before the surgery, during the surgery, and after the surgery. Okay, so and also in all this, we can encompass all this in patient education. So it's very important when choosing a bariatric surgery, about what a bariatric surgeon, that you go to a place where they are very transparent with the information, very transparent about the cost, very transparent about the risk, and setting realistic expectations for the patients. Uh, when you try, or when you go through Do It Bariatrics, or through Dr. Luciana Valenzuela to request bariatric surgery, we are very strict, and we take your safety and your comfort as one of the main important things. So that's why sometimes, and we are not afraid to talk about the cost, about the real expectations, and about the risk that goes in having any kind of surgery. Um, Typically, what we do with our patients, we send them a quote with the exact price of what they are going to pay and what they are going to receive. Also, we have an informed consent uh, form that we send with all the information that you need to know. So we need to sign that have as a contract. And also, Dr. Luciana Valenzuela has, uh, talk with you before the surgery to set and submit realistic expectations um, on what you will have to do, what you will feel, and the to start to learn to using this tool. Dr. Valenzuela, one of the reasons why a lot of patients choose her as her surgeon is because she had a gastric sleeve herself. So she knows about the procedure and she knows about the process, not only as a doctor, but also as a patient. So she knows what anatomically changes your body will suffer from the 2 point of views. From She knows about it as a doctor, but she also knows about what you are going to feel because she has been also a bariatric patient. And that's one very positive thing of her and obviously of Do It Bariatrics. Okay, this slide, like I was saying, it's very important. And for me, it's very important because I have spoken with a lot of patients before, and they have mentioning that sometimes their social circle, their friends, their family, um, they're not as supported as they have or they must be. So it's often that you hear the misconception that bariatric surgery was the easy way out, which is not the case at all. Uh, Important on this bariatric surgery, it's a tool that you will need to learn how to use to accomplish your goals. Okay, so we are going to go and we are going to talk about specifically or one of the probably the most popular bariatric procedure right now, which is the gastric sleeve surgery. In gastric sleeve surgery, Dr. Luciana Valenzuela removes 80% of your stomach. It's a restrictive procedure because obviously when removing the 80% of your stomach, the size of your stomach gets very small or smaller. Um, and this is having being a restrictive procedure because the amount of food that your body or your stomach will be allowed to intake will be significantly lower, um, having the obviously the result of weight loss. It's a procedure that is done laparoscopically, which means the doctors only create 1 to 3 tiny incisions where they put the tools that they need to cut the stomach and remove the stomach. They also put a camera so they will be seeing exactly what it's going to be. So at the end, typically on a gastric sleeve, you will finish with only 3 to 5, depending on your BMI and depending on how technically available your stomach is for the surgery. Only very small incisions that are almost imperceptible. For those patients that don't want to have or looking a more cosmetic result after a gastric sleeve surgery, there is also the option of a single incision gastric sleeve with all the procedure is done through only one incision. After a gastric sleeve, typically you will spend, or after every bariatric surgery with our program, you spend 2 days after in the hospital. Now, the gastric bypass. The gastric bypass is not only restrictive, but it's also a malabsorptive procedure. On a gastric bypass, the doctor changes the anatomy of your digestive system, bypassing a large part of the stomach. That's the reason why the name is so bypass. Bypass is like the gold standard procedure for people who are suffering also from diabetes. It's also one of the most effective surgeries in long-term weight loss, um, and really improves a lot of the comorbidities. But it's also a more complex, technically speaking, procedure that carries a little bit more risk, and the cost is obviously a little bit higher because of the medical fees are also higher. The gastric bypass has a version that it's called the mini gastric bypass, where The procedure is done with only one anastomosis, so it's a less invasive procedure, but it works very similar to the regular or the complete gastric bypass because it's also malabsorptive in procedure that has certain disadvantages also. There's the same case with the mini gastric bypass, then the gastric bypass. And these disadvantages, it's that we can say that the aftermath of the surgery will have you will have to be more strict on what you need to do after the surgeries. Okay, and the last surgery that we can also talk about is a revision surgery. A revision surgery, it's when a patient already have a, a bariatric procedure and want to have a second bariatric procedure. Probably one of the main reasons, or there are several reasons why a patient will be getting a second bariatric procedure. Obviously, the most logical one is having weight regain, but a lot of people also come for revision surgeries because they have experienced some complications, or they want to their obesity was very high or class 3, so they need a two-step surgery to accomplish their weight loss goals. There are, well, not every surgery can be performed into another surgery, but usually it's very common that patients right now come to remove a lap band and to convert this surgery to a new surgery like a gastric sleeve or a gastric bypass. As you can see on the screen, there are different reasons, and according to each case, the doctors determine if you're a candidate and what you will have to or what you need to expect after a revision surgery. It's very important, and well, one of the main reasons and one of the main things is that um, the expected weight loss after a revision surgery it's lower than if you're having a surgery for the first time. So we come to this part on why Tijuana. It's one of the main reasons that I already covered a little bit of this, but that is one of the main destinations for medical tourism in the world. Um, Obviously, we have uh, a very geographically advantage that we are very close to San Diego, California. So the city has a lot of medical tourism, not only for bariatric surgery, but we also have medical tourism from all over the United States because the United States health system it's very complicated. So a lot of patients from the United States choose to come to Tijuana to have their medical services. There's also a lot of people coming for plastic surgery, a lot of people coming from dental services, and this has been happening since forever. It's not a new thing in Tijuana. We have had there are a lot of dentists in a lot of places, and obviously the main reason is the complicated health system that it's in Tijuana. There's also a lot of medical tourism from Canada. Canada has a very good health system that has a very good reputation in the world. The problem with Canada sometimes is waiting times. So if you want to have a bariatric surgery in Canada, you will have to wait probably 2 to 3 years so you can complete the whole process. But if you do it in Tijuana, it's the same as New Zealand. You can get approved in as easy as 2 weeks. Uh, and well, like I mentioned it before, Tijuana has become one of the main hubs for medical tourism. So there are world-class surgeons in Tijuana performing their practice, like Dr. Luciana Valenzuela, that has the impressive amount of more than 10,000 successful surgery. Obviously, in Tijuana, you save a lot of money. They're a lower cost compared to New Zealand or Australia, and without compromising quality. We have state-of-the-art facilities, and all of the companies have a medical tourism protocol in place that we have the service that we can help you with all the travel arrangements, with all your transportation, and with all your lodging. that we will go over that in the next slides. Okay, so typically starting your journey to having a surgery in Tijuana, it's very similar to the process among every company in here. First, submit your health questionnaire or submit your file or all your medical information, getting approved. Then you start your travel plans, and this is where your patient coordinator, like myself, comes in handy because we will be helping you, guiding you, choosing which airport you are going to be flying to, because there are two options, choosing your airline, choosing the best arrival time, help you with the weather. For example, right now in New Zealand, you are in the summer, and here we are in the winter. So right now it's kind of chilly. Also, the time zone, right now in Tijuana, it's 10 p.m. I know that it's 7 p.m. in Friday for you guys, but for me, it's 10 p.m. on the night before. So this is kind of time traveling, but that is the role or the importance of your patient coordinator, that it is our job to help you in all this process. One of the main questions that we usually get specifically from New Zealand, it's that if you need a visa. And the answer is no, you don't need a visa to enter Mexico, and you don't need a visa to enter to the United States. It is considered that New Zealand passport is one of the most popular passports in the world. The only thing that you need to do is apply for an ESTA. The ESTA application, it's very easy and can be completed online. You will be requested if you are flying to United States instead of flying to Mexico. And here comes the second question. The second question is why we recommend flying to San Diego. And the reason is this: we are closer, we are very close to San Diego. Actually, it's a border city. San Diego, it's on the American side. Tijuana is on the Mexican side. So for us, picking you guys up from San Diego Airport, it's very easily. It's just a 25 minutes drive. So it's going to be a lot easier. And when entering Mexico, you don't need a visa. If you enter Mexico by land, you don't have to prove or present any type of document, but you will need your New Zealand passport and your ESTA when going back to the United States. But it is our job, and we will be with you, helping you with all this information that you will need if you decide to come with Do It Bariatrics, to come to Tijuana to have your bariatric surgery. This is like a map, or you can see on your screen the map. The blue line, it's the road specifically from San Diego Airport to Tijuana. Like I was saying, it's a 25-minute drive. On the image that I selected, it's saying 40 minutes, but this is because it's a very high traffic area. So I just took the screenshot a little earlier than the webinar and put it in there. But this is just to show you how close we are to San Diego Airport. So that's one of the reasons why we recommend flying to San Diego. It's also, you will hear the recommendation in some companies recommend that you fly to Los Angeles Airport. Los Angeles, it's a little bit more north. It's like a 3-hour drive. And a lot of people that are coming from New Zealand, and the reason it's because there is a direct flight from Auckland to Los Angeles. So you don't have to do a layover or coming to San Diego. And we can also pick you up from an additional fee directly from Los Angeles Airport. But we will be helping you with all the transportation, all the things that you need. So when you get to Tijuana, what you will expect, or what is going to be the main difference of doing it with Do It Bariatrics and other company, you will have your complete pre-op evaluation and meeting with Dr. Valenzuela before the surgery and after the surgery. The surgery gets performed at a very modern facility that is Blue Medical Tower. I will show you some pictures. And you will have, and this is very important also with what's happening in Tijuana with weight loss surgery. With our packages are designed by Dr. Valenzuela herself, and she requests to have the patient 2 days in the hospital after the surgery. Some companies or some doctors can offer you shorter stay in the hospital, and that's the reason why in some places the price is lower. But for your safety and to following all the protocol, ensuring efficacy of the treatment and also your safety, we or Dr. Valenzuela's program request for you to be 2 days in the hospital. Obviously, well, this is all including in your final plan, right? Like I was saying, this is Blue Medical Tower. This is the hospital where we are doing our where we are doing our surgeries. It's a brand new hospital. It's in the process of having a certification by the Joint Commission International. It's going to be one of the few hospitals in the whole Mexico and the only hospital in Tijuana with with uh, with this certification. And right now, Blue Medical, it's brand new and it's in the process of having this certification. Well, I'm going to show you on screen some success stories of patients that have visited us before for gastric sleeve. And this is like just to give you some motivation, to give you some encouragement to have the weight loss surgery procedure. And the same way that I started this webinar, I will be very repetitive about this. It's that it's not a cosmetic procedure. It's a procedure for your health to expand your it's a life extension procedure. It's not a cosmetic procedure, but we cannot disregard that these beautiful ladies have performed the surgery. They also feel better and they also obviously look better after a bariatric surgery. Uh, well, thank you very much for joining this webinar. We are going to have a little Q&A session. So if you have any kind of questions, any need additional information that I haven't covered during this webinar, I will be more than happy to help you with all the information. So I'm just going to be waiting a couple of minutes to see how many questions I can get from you guys. So if you have any questions, just put it in there. Just click where it says Q&A, and we will be answering your questions. Or I can allow you guys to talk if you request it, or if you raise your hand virtually. Okay. Okay. Thank you very much, Nikki, for your comment. I'm seeing your question. Okay, Tanya, does the package include a nutritionist or psychologist after the operation, or do we organize our own back in New Zealand? Okay, I can answer this question, Tanya, in two ways. The package does include a nutritionist or a dietitian that I will be in touch with you, helping you, and like we were mentioning before, teaching you or showing you how to use this new tool. So that is included. What we do not include in the package is the psychologist after the operation. You can organize your own, well, going back to New Zealand, but we all already have arrangements with aftercare physicians and psychologists from New Zealand that can really help you and that we can refer you guys to. So, like the answer is yes and no, but we have companies in place that we are very in touch with them that they will help you to get all the information that you will need after your surgery. I hope I hope I have been answering your question, Tanya. Okay, I'm having another question right now from our broadcast and on the internet. It's something that we covered during the webinar, and the question is if we recommend flying to San Diego or to Los Angeles. And the answer is we recommend flying to San Diego because it's going to be a lot easier for you guys, the transportation that we will take care of. But also, when you go to Los Angeles, you will need to go from Los Angeles to San Diego if you want to be picked up at San Diego. But you will need to go through using a train. So sometimes it can get uncomfortable, not when coming here, but when going back after your surgery. The one thing that we have learned about Kiwis, about New Zealanders, is that you guys like to travel a lot. So for me, it has been very impressive meeting people from New Zealand because they usually or typically arrange all the things by themselves, and they are very easygoing person and they want to travel a lot or so do sightseeing after the surgery. That is one of the things that we can also help you with. But it's very important with Do It Bariatrics. We are not a medical tourism facilitator, so we do not have in place tours or things like that. We can refer you to other people that can help you with this part, but we are also on the medical part, and we can help you with transportation. We can help you with lodging. And we also have some arrangements with companies from New Zealand that they gather groups of people that come here that they can help you. That if you're interested is to coming with other Kiwis or other people from New Zealand, we can easily refer you to them. Okay, one question, and this is very important. It's there's if this is another question that I'm getting through Instagram. It's that if we can help you guys with the letter for KiwiSaver, and the answer is yes. If you want to access your KiwiSaver funds and you need a referral letter, we can also help you with that. Um, I have another question. It's that if you need to place a deposit to schedule your surgery, and the answer is yes. Typically, we request a deposit, and this is because just the commitment and all the spending that we will have to do before your surgery. We need to schedule the hospital, schedule your hotel, and also your driver and your transportation. So yes, we request also a deposit that is a $250 deposit. Another question is how far in advance can I schedule my surgery? You can schedule your surgery as far as 2 weeks ahead, uh, but the recommendation is to do it earlier because, like I mentioned it first in the first part of the webinar, Dr. Valenzuela reviews every case individually. In some cases, or in some specific cases, the doctor can request for you to do a longer diet. And that's one of the reasons why it's recommendable or advisable that if you're planning to having your surgery during these years, that you can do it as far as advanced as you can, because it will help people planning. And also consider that the travel from New Zealand to America is a very long trip. So a lot of people from New Zealand like to do some sightseeing or like to do other things while in California. So that's the reason why it's recommendable or advisable to do it with time ahead. Okay. Okay, guys. Well, I don't seem to have any additional questions if doing it here on Instagram or doing it here on Zoom. But please rest assured that if you need any additional information, I will be more than happy to provide it. You can request or you can visit our website. I will put the website on the comments, on the comment section, just for you guys can have our website, which is doitbariatrics.com. I will also put the link of our health questionnaire if you want to submit your questionnaire. And the last thing, it's I will put the link of our Facebook support group. That is one of the things that also you need to consider before choosing a bariatric surgery in Tijuana. It's that typically we have our Facebook support groups where you can meet other people that are in the same process as you of choosing the surgery or after the surgery. I think I have another question in here. No question. Does the packaging, okay. Okay, is there a lot of pre-planning with liquid diet that we do beforehand? Um, Hi, Tanya, thank you for your question. And there's not a lot, but there are some pre-planning. When you schedule your surgery with Dr. Valenzuela, we will provide you with a document that it's the pre-operative guidelines with the diet that you will need to do before your surgery and the recommendations that we use. Usually when a patient's um, schedule a surgery with Do It Bariatrics, you are very in touch with me with questions, with all the information that you need. But there are some pre-planning. For some patients, could be a lot. For some patients, it's not a lot, but it's on each specific case. Okay, well, thank you very much for your participation. Thank you very much for your question. Like I was saying before, if you have any additional questions or you will need to speak with me directly, or if you need a consultation with Dr. Valenzuela, I will be more than happy to arrange it. Thank you very much. Special regards to Nikki. Nikki, thank you very much. You have joined a couple of webinars now. If you need any information, I will be more than happy to provide it. If there are some information that I haven't covered during this webinar, you can also send me an email. And like I was saying, I'm more than happy to provide it. And thank you very much for joining. For those that are going to watch the recorded version, it's my regards from Tijuana. And thank you very much. We are done for now. Have a wonderful day. Bye-bye.